was shed for my righteousness, and now I walk in victory. Oh, and now I walk in victory. Yeah, 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 yeah.
And she's no less a person than Lady Ifi Okaro, but ably represented by Honorable Chinonye Idigo, SSA to the Governor on Quality Assurance in Education. Put your hands together for this. To the high table. A man I call my Oga, my friend, my mentor. Ladies and gentlemen, Dr. Fanny, SSA to His Excellency on Secondary Education. Please put your hands together for Dr. Paul Ifani. Seated here, may I have the honor and privilege of inviting a woman of immense wife. And she adorns the TV screens of every Nigerian home. And she Ebele Okaro on you. Put your hands together as I invite her to the high table. Thank you. I will still recognize that will adorn the table, the high table. But before then, introduction, may I introduce and welcome to this great event. Wherever you are seated here, I want you to know that you're important in this event. May I introduce and welcome to this great occasion Nzekwe Enemo, member PPSSC Anambra State in charge of Otuocha Zone. Put your hands together. Okemwa, we salute you. Okemwa Aguleri, we salute you and welcome you. Chukwebuka Ugu, the representative of the World Health Organization. Please put your hands together. For this will not be possible without people like this. World Health Organization. Thank you so much, sir, for being here. God bless you. Thank you. Thank you. We also like to recognize and welcome to this great event, PPSSC Ogidi Zone, Dr. Uche Chibo Okeke. Man, you're welcome. Please, I want to crave our indulgence. Center. Madam known as Reverend, please be Niru, please. If you see any seat tagged, please don't so. It's also tagged. Please, let us look as if people are here. If you find time to laugh and laugh. Before the end of the function, they will go and produce and come back. They will be sharing. If you pay, you take yours. Is it not true? Everybody had gone home. I was the only one remaining as the MC. I was waiting for my balance. This man, flipping through his pictures, looking at me. All of a sudden, he brought the picture of one fat man. I said, "Okay, take your picture." I said, "You crazy now? Maybe this." He said, "Okay, take them now, so it will be when you get money." I said, "God forbid." I think I can see a lot of movie stars there. I will be failing woefully in my duties as the MC of this function if I fail to recognize the Nollywood actors that are here. Now they call all of them actors, no longer actresses, now actors. I want to say welcome to you. I can see Chimoke, my friend, and the host of you. Thank you so much for being here. God bless you. God bless you. Notable women. Hello? Any woman here? Because women are more intelligent than men. Women, do we agree? Now, say, yes, the boy my digger on a no, busy in a staircase. Men, do we agree? A man is driving and the wife is seated on the front seat of a vehicle. She doesn't look straight. She'll be looking at the man to see if the man will look at another woman. And men, when we want to look, we look like mumu, they will catch us. One, they drive, they look. Then the wife caught him. Do you know what this man started saying? Now, wow, Obi Anona look all on a state here. When you say, shut up, Onyori, only at the Puniro, not only here. But when women, they want to look at another man, they involve the men. She'll simply say, honey, then stupidly you will join her, she will see everything she wants to say. Can we give it up for women? You know, sometimes I wonder when there are no women, no children. You know what children add to families? So women are wonderful species, wonderful people. But what I don't understand about women is that, why is it that women form a lot? You know, their hands are always like this when they walk. Is it because of the handbag that you carry or your nature? I love Oka people for one thing. Mrs. Victoria Onebo, welcome you. We say thank you for being here. God bless you. All right. Here is a unique species. Is an extraordinary person, and it doesn't like to be talked about in that way, but I don't have a choice than to tell you this. I met him in his father's place, and the night before the occasion we talked, and I saw a man with a vision. I saw a man with a purpose. I saw a man who is not just educated but also intelligent and loves his people. So that formed the reason why he's doing this. Sometimes people do things not because of money, not because of a personal aggrandizement, but because of the passion to help humanity. That is the man. Dr. Onyebuchi Chris Ifediora. Put your hands together once again for him. As we get set, and he tried to help the person. Voila. That thing he wants to say, he must complete it. When Kemoni Inaga one day, the other day I went to Mano Lagos, actually, we say Lagos. I said, thank you. Lagos, my brother. We must complete it. I've helped you. Just continue the other ones. This movie star just entered this arena. I am talking about the former Commissioner for Health, Anambra State, Dr. Joe Akabike Okobluzo. Welcome you, sir, for this. And I think you deserve to sit. Okobluzo. I say, Shadrach Nana, she wrote, what of you of inviting to this great occasion and to the high table His Royal Majesty Igwe Ekwalo Obago of Umuobanam. Put your hands together. Yes. Obago and I say no. serious matter. If one yana yala meli abele.
Months ago. And this 16 months ago, I've never had very strong problem. And it is so growing, so rare. I'm saying this way. It's thinking of the children of this particular zone. Any day I get up from my bed, once I pray, I'll say, God, thank you. God should give you the finance to continue with what he's doing.
President, may I have the honor and privilege of introducing and welcoming to this great event and to the high table His Royal Majesty Igwe Victor Ntoka, Yano Cheze Ntoka, Igwe Nsube Orola. Please put your hands together as invited to the high table. Yes. We also have the Yobu Buchiche Amarom North. Put your hands together. Ngozi and Sono is there. We also have Ikoroha. Hope I got this right. Yes. Ikoroha, yes. And then Populoka. Thank you. And Chinwokenba is there. We have Rita Arum. Rita Arum, you're welcome. Phil Daniels Aniedo is here. Phil Daniels, we thank you for being here. Yes. They are naked twins. They are not Chima and Chidi Ebere. They are here. Yes. Nkechi Naji is here. Nkechi, we salute you. Welcome. Now, Angel Emeka is here. Angel, thank you for being here. Nkechi Mweje. Yes. Esibo nwanyi Onitsha. Ono de titi ayi na ayi na ekere. Unama kona Queen Nwokoye na eba. Queen Nwokoye ko wa tabi ka ife. Ono nilo. Okay. And also Stella Udom is here. Stella, we thank you for being here. Uju Edochi Uju Nkai. Kedia. Ono nilo. Uju Edochi na eba. And Ifenna Chukwuka, Ujumna Chukwuka, you thank you for being here. And then Tony Ezindo is here. Uchi Ngozi Eze Evuka is here. Ngozi Eze will salute you. Ibiwari Etuk is also here. Ibiwari, we thank you for being here. And also we're not missing Ibe Georgina. Ibe Georgina, thank you so much for being here. Joy Steve is also here. And the last but not the least, Uju Anikwe is also here. Thank you so much for being here. I assume the fact not easy to be a movie. We will start this event, and the way to start this event, 1, 2, 3, go. Anambra State.
We pray and ask, God bless Anambra, God bless the shining light that we bear. We're the only ones to make her brighter, the only ones to make her better, the only ones to make Anambra shine. With our sweat and love, every breath of our lives, we've trust in God. We will lift our home and high. We believe in togetherness. We'll build a land of progress. Lift the spirit of Anambra. Lift the spirit of Anambra. Lift the spirit of Anambra. States we love.
Please, as we are still standing.
Of the Holy Spirit. Father, we thank you for this great day. We thank you for your blessings. We thank you for making this day possible, particularly our brother and all those people that came from far and wide to participate in this event that will help us to prevent preventable days in Anambra State and all over the world. We are praying that you sustain this program. Let us also appreciate the offer, the person that brought this, and the government and people will buy into it. So at the end, you have a cause to justify that we have made this day through Christ our Lord. In the name of the Father,
just like them. And then near big hereditary. Onatazia, each of the open near the Anochazi, Igwe, or the Kutina, as says a Queche, Gola Nyoji. And may go. We make it a lose. Ewe bello, ubelu sheet. Location below Chia. Mama Lanyo to Anafa Jesus. Anambra State. Mrs. Z.E. PPSSC.
Onye maara ji wee bịa ebe a tata bụ Chris Fediola. Also Australia wee maa na ọ na-ego oge na-elote Nigeria na-elote Anambra State. Edere ebe anyị kwuru about breast cancer and cervical cancer. Nwunye gị yabago, nwa gị yabago. So na ọ ife metụtara anyị ndụ onye ọbụla. Ọ bụrụ sọ ndụ ụmụ nwaanyị. Maka mgbe nwunye gị na-aya, ya na-aya, mgbe ya na-aya, nwunye gị na-aya, wee na-ekele Chukwu lelie onwe duru anyị ebe anọ taa. Anyị wee na-ayị ya maka ndụ ndị na-achị Anambra Steeti, gọvanọ anyị na nwunye, na-ayọkwara ya maka ndụ anyị nwa ndị a na-achị, wee na-ekene ya. Ma ọ bụkwara ma nche n'abalị nya teta n'ụtụtụ a nọ na ọ kwadoro ọnọdụ ya ka eji wee ebe a nọ bịa ya n'udo nke na-elotọrọ wee na-ayị ya ebe ka ọ nọnyere anyị ebe a ya na-agba nwaanyị ume ka foundation a grow n'ezigbo foundation ife ọbụla bụ health. anyị ma some of our prominent children nwụgoro na breast cancer. N'ọ ya a na-amara mgbe ọ na-ebido but kịta ibe o kwuru esigbo mmalụ ka esi prevent ya onyere anyị akarị ilu wee na-ekene ya nwa nke nnukwu mmanụ ya ga-eme ka ndị beba ite elile n'ibe ọ jere mụta n'akwụkwọ wee na-ekenekwa Chukwu ụlọ ya ba na-ayị ya emetụtụla anyị ibe nwaanyị bụ n'obi wee si Australia ga-ebe a sị na Kristi dị nwe n'anyị.
Great foundation. No.
OCI Foundation. My name is Nebechi Ezenaya, and I'm here to present a poem written in honor of the president of the OCI Foundation. I know a legend who lives for all mankind, whose cheer arouses from the smiles of the impoverished. His acts of philanthropy never ceases to exalt his legacy. We rise by lifting others. He is to be remembered forever. I know a king whose ornateness radiates vehemently, whose words are reliably soothing, sacrosanct, and succinct. He is a true leader. I know an exceptionally outstanding father who gives family its quintessential meaning. His good works are evident in their smile. He is a true man. I know a genius doctor who makes me wonder if Ben Carson had an African descendant. Gifted are his hands. He is an angel to the unwell. Thank you.
Ifediora, please put your hands together for him. I am talking about no less Commissioner for Basic Education, Anambra State, Professor Kate Azoka Omenola. Well, she is representing here today.
Omenola. She would have been here in person to carry put together by one of our own who is thinking home, irrespective of the fact that he's in faraway Australia, and he thinks about us, he feels for us, and has come down to assist us as much as he can under the auspices of OCI Foundation. I salute you, sir. For this great and a milestone intervention in the health system. The main parts of today's events are to announce UNIZIC as an official partner to the Arm Our Youth campaign. Also to unveil some Nollywood ambassadors and reveal the Civic Breast app, a mobile phone application dedicated to the campaign. Arm Our Youth campaign textbooks will also be distributed to secondary schools in Anambra State in this program. Permit me to use this opportunity to observe that the cervical and breast cancers are major challenges of health care, particularly in developing countries like Nigeria. Studies show that cervical cancer is the fourth most frequent cancer in women worldwide, most common in developing countries like Nigeria, particularly among women aged between 15 and 44 years. Data from 2012 revealed that of the 445,000 new cases reported across the world, about 84% occurred in developing countries. In addition, of the approximately 270,000 global deaths from the cancer, over 85% occurred in these same countries, the developing countries, of which Nigeria is one of them. It was further reported that in 2017, a total of 14,089 Nigerian women were diagnosed with the cancer, and 8,240 of them died. Are also major health challenges in Nigeria. Studies show that in Nigeria and other West African countries, about 37 people out of every 100,000 women in a year will develop breast cancer. More worrisome situation in Nigeria is that after 5 years of being diagnosed, only 1 person out of 10 will survive. There is a good news. The good news is that these two monstrous challenges of our health can easily be handled if dictated early. It is on this note that I wish to commend the intervention of OCI Foundation in this Arm Our Youth campaign. I also wish to use this opportunity to call on the government at all levels, non-governmental organizations, philanthropic individuals, faith-based organizations, universities, and indeed the general public to join in this campaign. The OCI Foundation has taken the lead in Nigeria. There is need for all hands to be on deck to make a success of this fight and thus ameliorate the devastating effects of cervical and breast cancers in our society. Thank you very much.
Yes.
In Nigeria. Today I stand with OCI Foundation. Now I go with ArOY to practice, to advocate, to campaign and prevent and reduce controlled breast and cervical cancers. I'm as young, I'm as old, I'm as now, I'm as young, I'm as old, I'm as now.
Gentlemen, can you put your hands together for that? 821DY. These are, but please listen carefully. You might remember Lagos number again, LSR 821DY. Please go.
Examination and the breasts.
Nne m jọọ ya last ị ma na ebe anyị si abịa bụ otu ọcha. Nna m jiri mụ ibe na-ekwodo na-arụ bụ ana m akụzi na CSS ụmụ ọba na mma ibe na-ekwodo na-arụ anyị emegibe breast cancer bụ mee abụọ mana asụmnwoke m bụ ịba na klaasị ka ikwu okwu breast cancer ọ dị ka ịchụọ ụmụ nwaanyị ọ bụ n'ihe na-emezi bụ mpụtazi ya nsị prịnsịpal chọwanụ ya ticha bụ ndị omukwu. The last one we had here, I emceed it in Otuacha zone, and I said something. I'm a private, not a general. I'm putting a receipt breast cancer. Yeah. Oh, you put one neighbor in arrow. Then again, they go na sad man na all about. They want to do the video go celebrate. Na all y'all na the one man who do no. On the go is event na we put. Na mo kono dalu. Ne wa go through the video. They don't want to do now. Bo, yeah, you want to be a new. You want to do the video there now. You have a time more. Bo, be a joke. Want to do a call on now. Call your neighbor. Give them maybe more. Bo, and one more take video. Them allowed it. You want to go see you. I want to come on the child. If you are black African, maybe you. If you are a black person, you have the advantage. Oh, what a wedding in Nigeria. I saw one guy who was on television. I was with a routine. No, Cholenon. So, could they do? Also, I'm going to man about the breast cancer. Now, I've got a TV. I say, I'm on here. Mama, I'm already alarm. I'm not going to get water all the time. So, I'm maybe you have breast cancer. I see people pocket cancer. Maka, all them walking back. And that reminds me. Ndem Josephine Anambra no kunebo. Ina dalu. O wana nje keresi onye nna ekene maka supervision elu no nkuzi ka mbu. Egwu member na represent Otuacha zone mpuje kita mu na ese foto. Abịa supervision abụ na edere m lesson note nsi e no ka nwa agụle mbiwe. Nya na table mbiwe. Onwuru supervision make ya. Onye ogbu mmemme na atọrọ asị ka unu rama aka. Thank you so much. I'm apostle.
When you think you know how to the prestigious Nnamdi Azikiwe University Oka Professor Charles is extraordinary per excellence. You may interest you to know is the chief host. This is in your national, state, the before you look at them,
by Honorable Chinonye Ibigo, the representative of the World Health Organization, Dr. Chukwuemeka Ogu, the former Commissioner for Health, with whom we started this program, Dr. Joe Akabike, Ndigwe here present, His Royal Highness Igwe Victor Ntoka, IL the First of Nsugbe, and His Royal Majesty Igwe Ekoba of Umoba, Igwe Ekwala of Umoba now, Lolo, the OCI Foundation's legal advisor, Barrister Onyechi Ononye, and all the other key officers, trustees, and volunteers of the OCI Foundation. The OCI Foundation sole ambassador, Mrs. Ebele Okaro in UK of the Nollywood fame, and all the other Nollywood ambassadors here present, the PPSSC zonal directors and board members, gentlemen of the press, ladies and gentlemen, I say welcome. Thank you very much for being here today. We feel very privileged to have you all as guests and witnesses to this historic event, which is the official commencement of the Arm Our Youth campaign. We'll be proud to remember. I'll share a couple of stories with us all that will underline why we are doing this program and which we can all relate to. Nearly 15 years ago, I was a youth copper in Oyo State. A copper colleague of mine walked up to me one day and was in tears. And I asked him, what's the problem? He told me that his big sister, who at the time was 28 years old, had just been diagnosed with breast cancer. He wanted me to tell him that the lady would survive, because I couldn't tell him that. I told him to get more information and find out what exactly is the problem. About a week later, he came back even in bigger tears, and the problem was the cancer has gone beyond the breast. The family was broken, the young man was broken, a family that was once happy became a bit hopeless. I don't know where the young man is today. I've not been able to track him down. I don't know what became of the fate of that young lady. The second story was when I was a house officer at the Lagos University Teaching Hospital in Lagos. The lady in question was my patient, our patient. She was in her mid-40s, and the problem was cervical cancer. As a young house officer, we do rotations. I left the unit before anything could happen, only for me to see the daughter a few months later, and she told me that the mom passed away. She became motherless, and obviously their dad became a widower. I'll come back to these stories later, but briefly, the Arm Our Youth campaign is the flagship health initiative of the OCI Foundation, designed to be a wide-reaching, sustainable, and cost-effective way of spreading breast and anti-cervical cancer messages to millions of at-risk Nigerian women in a way that is timely, efficient, and culturally acceptable. Primarily, this campaign targets students across all senior secondary schools in Nigeria by introducing the relevant teachings into their regular academic curriculum, along with assessment and examination systems. Through the Survey Breast mobile phone application, which is now available on the Android Play Store, this campaign will potentially be within the reach of every single Nigerian. The Arm Our Youth campaign is novel, it's an invention. It is comprehensive in its packaging, it is engaging in its delivery, and it is unique in its offering. It is unique because, to the best of our knowledge, it's the very first campaign anywhere in the world to target young women in their mid to late teens while in our formal academic settings. It is unique because it's the first to have the teachings that will be repeated multiple times over a number of years for the same cohort of students. Along with its inbuilt assessments and examination system, this feature improves engagement from the participants and will guarantee long-term sustainability of the lessons they gain. These are the major weaknesses of previous existing campaigns. Ladies and gentlemen, this program is also unique because the scientific evidence that underlies the initiative was scrutinized by multiple experts around the world and published across 5 different peer-reviewed journals of international reach and reputation. There are many other reasons why this program is unique. I'm going to put us through a few of them. It is the current program that is being rolled out across today. We are fine-tuned through the input of a 28-man working committee. This committee, many of whom are present here today, were made up of representatives of major stakeholders and religious faiths in Anambra State and Nigeria. They ensure that the program we are offering is culturally, religiously, professionally, and technically acceptable to all concerned. This program is also unique because it has an evaluation and a research component attached to it. And this evaluation is being overseen by the Griffith University Medical School in Australia. The research team for this program has in its fold 5 seasoned academics drawn from 4 different universities across 2 countries and across 2 continents. Some of them are here, and this team boasts of at least 1 university professor, at least 1 associate professor, at least 1 senior lecturer, and at least a lecturer. This program is also unique because it's a nationwide program. By 2025, we believe that all schools will be benefiting from this across all communities and all the local government areas in all the states and geopolitical regions of the Nigerian nation. Anambra State is only the first to benefit and has this privilege simply because the foundation's activities commenced right here 2 to 3 years ago and have therefore garnered lots of support, goodwill, and the necessary buy-in needed for it to succeed. Finally, this program is unique because it combines a rare mix of teachings that promote high moral values with educative and life-saving tips. So, task of the day. Our task is also not just to celebrate the successful commencement of this program in Anambra State. Our main task, ladies and gentlemen, is to inform the rest of Nigerians that the OCI Foundation has them firmly in their sights and that the program will surely reach every single one of them. This promise should come as no surprise to those who have been with the OCI Foundation since it was established in 2016. It has been in our nature to carry everyone along. And with a life-changing innovation and initiative like this, we have pledged to do all in our powers to ensure that every single Nigerian benefits. Let us all remember that we did not just keep this gospel to the students in Otocha Educational Zone of Anambra State, where we started. We have no intention either of limiting this gospel to students in Anambra State. Who knows, we may even go beyond Nigeria with this message and mission. After all, this campaign is the first of its kind anywhere in the world, and the impact is expected to benefit all other developing countries in Africa and around the globe. This course is, even though we may not have the financial or political wherewithal to complete the tasks by ourselves, we at the OCI Foundation surely do not lack the courage, nor the dedication, nor the commitment, nor the skills to complete this task. Ladies and gentlemen, at the OCI Foundation, we do not just dream. We work hard to make our dreams happen. Put in another way, we live our dreams, and we know exactly where our dreams will take us to. As such, we know where we and Nigerians are headed with the ArOY Youth campaign. So please permit me to invite us all to a 20-year journey into the future of this campaign. Let us all imagine this. In about 20 years from now, we have an Anambra state where the ArOY Youth Campaign would have been in operation for about 2 decades. And in Nigeria, where the campaign would have existed for at least 15 years. In 20 years' time, the senior school students of today, who are mostly in their mid-teens, will be in their mid to late 30s. Majority of them will be parents. Some of them would have their own families, and some will be involved in either the policy making or policy implementation across the Nigerian nation. In 20 years' time, there will be tens of millions of under 40-year-old Nigerians who will be well versed on the preventive strategies, the early symptoms, and the risk factors of breast and cervical cancers. These Nigerians and those associated with them in any way will be well armed to know when to seek for help without waiting till it's too late. These young people will be able to tell a grandmother that lump in your breast could be dangerous. They will be able to tell someone, a sister or a friend, that that discharge you have could be a symptom of cervical cancer. Hopefully in 20 years from now, cervical cancer vaccinations, along with the relevant screenings for both cervical cancer and breast cancer, will be freely available in Nigeria. We hope that will be the case. However, the beauty of the ArOY Youth Campaign is that, should this never be the case, the campaign's beneficiaries will already be well prepared and ready to not only embrace the changes when they come, but they will be able to actively seek for these interventions. Simply put, this campaign will complement any future intervention. It even gets more interesting if we move from 20 years to 50 years into the future. Some of us here today may not be around then, but surely some of the students we are arming today will be there in the future, either as governors, or as ministers, or as lawmakers, or as company CEOs. Can we please pause for a second and imagine the kind of healthcare programs these future leaders will put in place when they eventually take over the reins of leadership in this country? So you see, we're not only creating enlightened youth, we're also grooming future healthcare leaders. The foregoing discourse is the future that the OCI Foundation dreams about. It represents the dream that has been encapsulated and presented in the ArOY Youth Campaign. This is why we want to arm our students young. This is why we want to arm them now. And this is why we want to arm them all. This is why we have spent so much and worked so hard to make this day possible. And this is why we will never relent. To us, the campaign is among the most important healthcare innovations and strategies in Nigeria and the developing world in recent memory. This program, I enjoy our government. OCI Foundation is willing to work with anyone and with any group and with all interested governmental or non-governmental bodies to actualize a nationwide implementation of this project. Open your doors to us. Open your ears to us. Let us all do this together. This project is for everyone. This project is a win for everyone. Women, men, fathers, mothers, employers, and the society at large. Because everyone has something to do with a woman, either as a child, or a sibling, or a parent, or an employee, or a friend, or a work colleague. According to the WHO, the representatives here, roughly 14,000 Nigerian women were diagnosed with cervical cancer. Well, then about 14,000 women, Nigerians, every year get diagnosed with cervical cancer. And unfortunately, over 8,000 of these women will die. Children and a whole lot of others devastated. We remember the story I told you when I was a house officer in Lutif many years ago. We can either continue to accept this unfortunate trend, or perhaps just pray over it, that we always do in Nigeria. Or worse still, we can just ignore it and hope it goes away. Alternatively, we can stand and fight. At the OCI Foundation, we have chosen to do just that. Stand and fight with our women. And comes at huge financial costs. with no guaranteed sustainability of the lessons passed on. The ArOY Youth Campaign corrects all this. It has the potential to reach millions at a time. And apart from the initial setup costs, it comes with minimal financial implications. It is also well aligned with the United Nations. Ladies and gentlemen, in rounding up this speech, may I remind our guests that the OCI Foundation was established with the primary aim of bridging and breaking down barriers to the attainment of health and educational excellence among Nigerians. It was formally registered in both Nigeria and Australia to promote and advance health, to advance education, and to advance social and public welfare. Our scholarships and educational activities have benefited dozens of brilliant but less privileged students and pupils across junior secondary schools, senior secondary schools, tertiary institutions. Some of them are here today, and we're proud to say this, and hopefully we're going to hear from one of them. The lady that sang the poem is also a beneficiary of the program. That's Nabechi. Thank you everyone once again for attending this event. Thank you to all the staff and volunteers, and all our champions and sponsors, and all our partners, most of whom are here today. Thank you to our Nollywood friends. Thank you to the media, and all who have worked behind the scenes to make this day a success. I invite us all to be champions of this campaign in our own little ways. Let us all inform our family and friends. Invite them to download the OCI Survey Breast app. And not just to download them, but to share them with all their friends and contacts at their workplaces, at their schools, the churches, the mosques, and most importantly, social media. By doing this, you would have all partnered with the OCI Foundation as we rise by lifting others. God bless you all.
Wonderful. This is awesome. This is awesome. If you look at the commitment out to everyone is by ourselves alone. I associate myself with people like with the chairman of the occasion here. We want to be a leader as it concerns health. Poem is also going, she will also be a singer.
To carry out these two functions. First, presentation of certificate to the Vice Chancellor.
As official partners to the ArOY Youth Campaign, and then do a few recognitions to that effect. Now, this may surprise a few people, you know, how the mighty this program. But I have to say that UNIZIC is blessed with a wonderful Vice Chancellor. Before today, I'm not saying this because he's here. Most of this is the first time I'm attending a function of the OCI Foundation. So most of what has happened in the last 2-3 years, I've never been part of it. So I've never met the VC before now. But UNIZIC joins the League of program. As you heard during the speech, the Harvard University Medical School had a big hand in developing this program to what it is today. The Griffith University School of Medicine in Australia, I'm part of them. They also have a big hand in what's going to happen in the next 12 months with this program. Group of schools. Here today, in this beautiful hall, doing this program. Part of this partnership is also why, you know, Anambra University, the mission for them is actually to help pass this message to the rest of the country. Get the right ears to hear this right message. So we're very glad to officially unveil the Anambra University as official partners to this program.
Yeah.
Now, as part of the ArOY campaign, we're not just teaching the students, we're also making sure that they stay engaged and that the lessons will be sustained over time. In that regard, we have textbooks that every single secondary school in Anambra State is going to get a few copies of. And we're very happy to present a few of the copies of the textbooks to Anambra University. So students in higher institutions, you can go to the library, make copies of this, read it, in addition to what's on your mobile phone. So please, Prof, accept this from you.
Yes, sir.
Thank you very much, the President of the OCI Foundation. I want to recognize the dignitaries seated with me at the high table and those who have been anchoring the program of our youth campaign together with the President of the OCI Foundation. I recognize Nigwe Noiba and the former Honorable Commissioner for Health, my very good friend, and to recognize our invited guests from different parts of the nation who have come to my university. First, I want to say welcome to Anambra University. No. Yes, earlier this morning we had a courtesy call. It's a courtesy call that the OCI Foundation paid to me, led by Associate Professor Chris Fediora. I said a couple of things, and in trying to accept to be a partner, I want to reiterate some of those things. First, I said, this campaign, when he spoke to me and sent the information through WhatsApp, was through WhatsApp we were communicating, and at the point through email. I quickly scanned through the objective because sometimes we're worried, to identify with certain people come with bogus ideas. But I just went through within the first 5 minutes, and I called him back. I said, yes, I said, this is very, very, very innovative. And I said, take my words before I see your official, letter and other thing. Just take it from me that UNIZIK is officially partnering with OCI Foundation. Pharmacist, and I know how difficult it is, to implement certain policies that have to do with the health, especially of our youth. But this is a program that is targeted at the youth. Anytime you want to save a nation, or you want to do something that is diagnostic and very positive for any nation, you must start with the youth. If you start with the youth, then you have gotten it. And I saw that this was targeted at the youth. The second innovation I saw there is that it's not a one-off thing. I've seen a lot of programs. They come and share, they can share drugs, share, some items, share diagnostic tools, do routine, check, and then that's it. As good as that is, it's not sustainable. So I saw a program that from inception, they built in sustainability, which is what we lack in the nation. I saw that it's something that is sustainable. And I want us to really commend them for that innovative idea. Getting this education of preventing cervical and breast cancer through what I call, empirical knowledge, not just didactic. Teaching them, and then evaluating them at the end, and then making them to be ambassadors also, I think is very innovative. So I told them that that's what I saw when I look at the thing I saw. And many times also, when things like this are coming, end users are looking at what are we going to gain? Is it coming to build something? Is it coming to build lab with this? No, but education is key. When we educate youth, and importantly the girl child, because if you get a girl child You know, it's a nation. You know, when we talk about people who develop nation, it's the girl child. These are the future nations of tomorrow. And I looked at this program and I said, this program, the OCI campaign group, the ArOY Youth campaign, anchored by OCI, is something that we must partner with. So I want to say again that I'm very pleased to have identified with your initiative. And as I told you in the office, our commitment is total, our commitment is complete, our commitment is all-encompassing. We'll be working with some of the members of the ArOY Youth campaign as they come along to see how we can further help, you know, to disseminate this, you know, this wonderful information beyond Anambra State. And as you have made me a partner, so I now have the legal seal. When I go for my CVC meeting, Committee of Vice Chancellors meeting, or outside everywhere, I can begin to talk to them with authority because I'm now an official partner. So I thank you. And I thank all our participants who have come, and the students. I only want to apologize, as I told you earlier in the office, you know, that today is one day that I don't know how it's going to end. Extremely busy. In fact, I'm multitasking. Before he called me, I was chairing 3 meetings at the same time. You can't believe, he's talking about reality. One was holding my boardroom, one was holding the office, the other one I was coordinating by phone. 3 at the same time when he called me. So I played with us. I wanted to stay to watch, you know, the presentation, the award, but I told him that it may not be possible to. So I've been here and calling me again. I've been trying to answer phone. Something I don't normally do when I come for function. I keep my phone on answer, but I was forced to answer to let them know that I've just stepped aside. I'm coming back. I didn't abandon them there. So I thank you very much, and may God bless you.
Age of liberation, and being a partner with OCI Foundation, this is a blessing of God, and I know the microphone, get up.
Okay.
Good afternoon, sir. Official partner of OCI. What is their initiative? This is cerebral and breast cancer.
Very innovative initiative. As I said during my short remark, my acknowledgement of what they did for us is very unique. It is a model that from the beginning was built to succeed. Anything you do and you build sustainability to it. And as I said before, you see, it's targeting youth. It's not targeting pregnant women as people do or married. It's targeting youth. And it's focusing on prevention. We know very well that prevention is better than cure. If you have knowledge about to prevent the disease in any way, it's almost 60% the cure. So I see the initiative as very innovative. And see, they're going to teach these students from the school, secondary school, you know, basic level, you know, about cervical and breast cancer, how to recognize it, how to, you know, prevent it, and what to do if you see signs and symptoms. Many times, diagnosis is the key, you know, things that happen, especially for cancer. When there's early diagnosis, there can be early cure, early treatment, which is what the foundation is actually preaching, telling them from young age how to recognize that, and have to be those who will be ambassadors. You may not have it, but you can recognize others who have that, and the society where they're going, it becomes part of them. So it's going to be widespread. It's going to have a multiplying effect. So I commend them immensely and that initiative, and we are proud to associate with that because, you know, when I came on board as Vice Chancellor, my vision is to be among the first 200 universities in the world. And by partnering with OCI, because I partner also with Harvard and other universities, top-ranking universities, automatically we are linked. Some researchers that will be doing data collection, university will be involved. So it's a symbiotic relationship. It's positive, one way or the other.
What advice do you have for others, vis-a-vis giving support to this
I call them, I call our entrepreneurs, I call our business moguls. This is where to invest. I call government agencies to also invest in this, because whenever you see something that will affect the nation and you target it from the youth, that's the best kind of investment to do. So I'm calling on all of them, all the business. I saw that Unison was part of it, but they will go beyond that. We'll have many philanthropists in Anambra and other places who can invest just even if 0.00001% of the fund. It will go a long way to help this. And I'm also looking at the public to also look at, they should also set up a trust fund where the public can, voluntarily contribute whatever you are putting to help to sustain Anambra State.
Okay, Prof, please, beyond that, in what way would the university quickly trickle down this our youth campaign here? Because we still have young people here.
So it's very important. We are going to involve both the student and government. We're going to involve, our Nayo Women Association, so that they will be doing these campaigns. They will be talking to them. It will be part of what we do doing orientation. We build it into our orientation of fresh students that are coming up, and they will create a workshop and then teach them about this. We create a path. Some of these things you are workshop training you are doing out there, through the Dean Students Affairs, we cascade it down. So especially doing orientation programs and those who are going for service, and it becomes something routine. So at least we know with that platform that even annually there will be about 2 or 3 workshops, targeting on this.
Thank you so much. Thank you for coming.
This is so when my wife for corner, I guess. Of your beach. I think maybe the Mount Festival and the other and this is Australia, and this is Japan. Next photo. So one man do not enter. I say what? We will face him now. More than the boss of number. We are not going to back up on one. But this one, I got no money. This one, no more than the academics to perfect. It's not easy. Now, for the next presentation, Mr. President, may we invite Dr.
Our chief host, the Vice Chancellor of Nnamdi Azikiwe University, our Honorable Commissioner for Health Emeritus, Executive Secretary, Primary Healthcare Development Agency, and other distinguished functionaries of Anambra State, our Royal Father, members of the Fourth Estate of the Realm, our Nollywood ambassadors, distinguished guests, ladies, gentlemen, my name is Chukwuebuka Ogu. I'm here on behalf of the World Health Organization Zonal Coordinator, Dr. William Komakech, as well as the WHO Anambra State Coordinator, Dr. Chukwumuanya Igboekwu, both of whom are unavoidably absent due to other official engagements outside the state. They really wanted to be here in person to deliver this speech, this goodwill message, but contingencies will require otherwise. I want to congratulate the OCI Foundation for this laudable initiative focused on the health of our young people. And then WHO is particularly delighted that part of the focus of the foundation is really on prevention of breast cancer and cervical cancer. As we all have heard in the statistics reeled out during the chairman's opening remarks, as well as the address of welcome by the president, cancer, particularly these ones in focus, are among the top killers globally as well as locally in Nigeria. So a laudable health initiative such as this one, being championed by the OCI Foundation, is something really, really worthy of commendation. And that is why the World Health Organization has chosen to identify with this foundation. Personally, whilst sitting at the back, I've downloaded the app, the Sevi Breast app, and it looks very well designed and easy to use, and I think it's quite innovative and idea. So, sir, be rest assured that WHO is committed to supporting your programs because it tallies with the Sustainable Development Goals of the United Nations, particularly Goal 3, and then our aim and mission as an agency of ensuring that all peoples attain the highest attainable standard of healthcare that will help them to live to the fullest of their potential, especially in the Anambra. And in closing, I would like to say once again that WHO commends the initiators of this program. We especially congratulate Dr. Ifediora and his team for the vision of this initiative and all the other activities they're engaged in to ensure better standards of health for our youth in particular and for Indian Anambra in general. Thank you very much.
Yes, represented here by Dr. Good ambassadors of the OCI Foundation for them to come forward for their unveiling. Yes, and I will be directed by who will do justice to this, Mr. Chairman. Ambassador Ebele Okaro-Nyuke of the Nollywood fame is a graduate of theater arts, a script writer, TV presenter, stroke producer, filmmaker, an entrepreneur, and a philanthropist. Sheets Productions Limited, based in Lagos, and her major as an ambassador in the Arm Our Youths campaign. Ladies and gentlemen, I present to you Lady Ebele Okaro-Nyuke.
Ladies and gentlemen, I'm glad to see the worthy ambassador. We couldn't have asked for anything better and to present to her the official certificate as the ambassador of the Arm Our Youths Health Campaign.
Yeah, okay. I'm not clear. Just one.
Ladies and gentlemen, I'm not supposed to say anything, but I can't resist, the urge to say something. As a matter of fact, this is my first time of meeting Dr. Ifediora. He called me and told me about this breast awareness and everything. Straight, it's one thing or the other. So we all need to be out there and help to fight cancer as much as we can. Most of my people here, AGN, AGN, AGN. Thank you. I thank you for standing behind me. And we will do our best through our own effort to ensure that we educate people out there. We'll post on our Instagram and whatever social handle that we use, and I'm sure we'll touch a lot of lives. Thank you all for coming, and God bless.
You're not sure your English.
Just in case Nollywood movies in many years.
Make bold to tell you this. So, ladies and gentlemen, one of my mentors, I am talking about no less a man than in Nigeria, talking about Bob Manuel Udoku Nsana Abankili, SSA to His Excellency on creative media.
Very much. I may not say much, but it's important that one says something with the perspective of what is going on now. In 1991, my elder sister was diagnosed with cancer of the breast. My sister, very first sister. About that time, I was heading to Ibadan for National Youth Service. So from Anambra State here, she was referred to UCH Ibadan. And I was the person who was making the contact. She was coming from Anambra here to UCH Ibadan. Severally, at some point, she couldn't continue. She fought that for about 2 years. By 93, she passed on. So when Ebele said, you have cancer in every family, she struck a chord home. I also have a friend in Oka here who, not up to a month ago, told me that he's been diagnosed with prostate cancer. But his own is, he said, the good thing, Bob, is, you know, people hardly share those kind of things. It's only you, like a doctor, will be able to know. But he was able to share that with me to say, the good thing is that I was found out early enough. I'm just coming back from Germany, and by God's grace, the treatment is going well. Your foundation comes at a time when people are despondent. People don't know what to do. But there is hope, because when I read up certain things on the internet, I find out that cancer is also being fought by the medical industry, especially in the developed society. There are improvements in treatments and medicines and all that. But then it's not yet freedom. And so it's always a concern when the issues are mentioned. And it's not just for women, men, everybody. Today, younger people are also diagnosed with cancer of order. To be here, and I was told what it's all about, I said, this is one course that we all have to lend our popularity to, our credibility to. Then another thing on the flip side, which is the government side, perhaps you might know, because the former Honorable Commissioner for Health is here, Anambra State government has set up the health insurance scheme, which the government wants everybody who is Anambra or who lives in Anambra to key into, so that when issues like this come up, they can also team up with your organization to be able to offer treatment, perhaps free of charge, to those people who are despondent or who need such treatment. We may not have money to give, money to offer will not do. So when we come to, assuming you want to partner with a bank, or not even partner, to ask them for money, and some of us go, from the gate, the manager will see us from the CCTV, and they will take us to the main room, conference room, and then discussion will start in earnest. Instead of thinking that we are coming for protest, they will know that Nande Abundi film. If I want to put a banker, so what I'm saying is, we're supporting you. Ebele is one of our major faces in the industry. And we have so many Ebeles. Ngozi Ezone is there. Look at them. All of them are popular. So you have a formidable team behind you. Thank you very much.
All right. We present the textbook for the ArOY Youth Health Campaign of Mangaluda. We appreciate what you've said. We are very grateful. Again and again, I thank you all the Nollywood stars that are here today.
Organizers of this event, my colleagues, Nollywood, is in support of what you're doing, sir. Whenever you need us, just call on us. Thank you.
Yes, as the MC said, Ngozi is on, with Nollywood. And we're very happy that she was able to attend this occasion. Thank you very much, madam. And we'll present these textbooks to you.
All right. Yes, big before I chase on car, Madam Manson and the movie, I can't conjoin me. Before we go to name ahead, some people should come up. Oh my God.
I go give you my life before you wake up.
In charge of over 2019, as a school principal of many years standing, Lady Olasi was also in Confederation of Principals of Secondary School and Corps. The OCI Foundation considers Lady Olasi's wealth of experience as a huge value in furthering our team's goal of finding a sustainable and culturally acceptable way of including the teachings of breast and cervical cancers in the regular academic curriculum across Anambra and subsequently to Nigeria. I present to you Lady Joy Olasi.
This one. See, a lot of people ask me, how did you get this done? How did you get this done? The answer is simple. People like Lady Olasi made it happen. We've been very lucky to have her. She's ever ready as a champion of this ArOY Youth campaign. Whenever you call her, she's ever ready to make out time to see whoever we want her to see. As a champion, she's opened doors for us. She's giving us ideas. And particularly one particular event when we've tried to see Innocent the very first time, she led the team that went to see Innocent. It was a very rainy day. It was very, very rainy. They waited for over 2 hours because they ended up in the wrong of the Innocence factories. But when I called her with apologies, she didn't. You wouldn't believe she's been waiting for 2 hours in the rain. And that's the nature of the champion we have today. And we're very, very proud and very, very grateful to you, Lady Olasi, for being part of this foundation, for being a champion of the ArOY Youth campaign. And we couldn't be happier, other than to present you with this certificate of recognition for what you've done for us.
I want to invite CEO of Innocent Group. Yes, represented by T. Gwen.
I want to thank you for the initiative at this young stage. Actually, when he came up with his ideas, I said, Australia, Nigeria, this kind of communication, how is it going to work? I said, okay, let me see. But he's so dogged, and in his soft spokenness, he will try to say, Mr. Lassie, is it so late to call him? And say, no, we are used to keeping late night, so you can call me anytime. And at the time, I thought he was at Nsugbe because he prepared very, very well. And I told him, count on me, that I can never partner with a program and go halfway. I will see it to the end. More so when it concerns saving life. More so when it concerns the students. And I am proud of PPSSC because we are pacesetters. Once you hand over anything to them, consider it done. People are saying how. We've already mapped out the syllabus, the workshop, and how it's going to be taught, and at the end, the children will go in for it. PPSSC, the principals, the teachers, you are wonderful. Thank you.
Anambra State, Nigeria, since 2015. Apart from being a medical doctor, Dr. Mrs. is care project management with an MSc in public health. Consequently, her background and experience is a big boost to the OCI our youth healthcare project. I present to you Dr. Mrs. Choma Ezenyimolo.
Introduce these wonderful people to everyone here. When we wanted to get champions for this program, we didn't know who to talk to. But Dr. Ezenyimolo represented the first of Anambra State on two different occasions to our programs. And when I remembered her, I felt she must be a worthy champion. But the surprise was when I did speak to her, and she came on board quite quickly. And if I say she's a champion of champions, that's not an overstatement. She's solved a lot of problems. Like, for instance, when we tried to get a venue where the workshop committee for this was going to sit, I thought I had all the plans for it, but each plan kept falling over and over and over. At the time, just about a few days to go, there was really nothing we could do. But they're very privileged and very grateful to the services she has rendered to the OCI Foundation. Thank you very much, Doc.
The chairman, members of the high table, especially my co-champion of I'm Your Youth's campaign, SSAs, to His Excellency here present, Igwe, representative of Innocent Company, Nollywood here present, ladies and gentlemen. I'm really delighted to receive this award from OCI Foundation, and I must say that the visionary president of OCI Foundation in the person of Professor Chris Ifediora has been wonderful. In fact, I can't believe I'm just seeing him for the first time, because he is so dogged, he is a master planner, and he really strategizes and synergizes the activities of the foundation. We have been on the WhatsApp chat, our group chat, and what have you, and it's been a family all this while. When he approached me to be a champion of this organization, there was no doubt in my mind, because I have seen what his vision and his plans are. Because as we know, breast and cervical cancer are those cancers that affect mainly the female population, and they are preventable. Breast cancer, just by doing the self-breast examination, the girl or the woman will be able to spot cancer when it's just forming. Usually it starts as a lump. The same with cervical cancer. Cervical cancer is sexually transmitted. It is caused by the human papilloma virus. So just by prevention, we can prevent these two cancers. And of course, we have seen the strategy he's going to employ to make sure that all the girls, especially those in the senior secondary, have this knowledge and are tested by way of examination. So what I want to say to you is that you have our full support. Full support from Ministry of Health, full support from Anambra State Primary Healthcare Development Agency. Once again, I say thank you.
For Education 2014 to 2018, the state has been winning national and international laurels. Hence, we in the OCI Foundation are pleased to have this erudite professor as the first sponsor of Our Youth campaign.
Brief, but that does not true sponsor of this campaign, and we're very, very grateful to Professor Menora, ably represented here by Dr. Fo.
He is the chairman and CEO of Innocent Group of Companies and a business mogul, an entrepreneur, and the first African indigenous motor manufacturer. Innocent Motors. Chief Innocent Chukwuma is well known as an enterprising work and has carved a niche for himself. OCI Foundation proudly counts on his sponsorship to drive the Our Youth campaign project, post-primary. Okay, yes. Ladies and gentlemen, I present to you Chief Innocent Chukwuma.
Surprised at how Innocent got involved in this. I've been probably surprised myself, but Chief Innocent Chukwuma, the Innocent will know, is a wonderful gentleman. I only just met him for the very first time yesterday, but he's already played a big role, and the fact that he's being represented here today speaks volume of the kind of gentleman he is. We're very grateful if you can pass on the message to him that he's part of this program, and we'll present this certificate to him.
On behalf of the chairman of IVM Innocent Group, Chief Dr. Innocent Chukwuma Orefako, I receive partner of the arm of our youth health campaign, Anambra State. Unfortunately for me, I was around yesterday when you came to see Chief, and he promised to be here, but I can come ahead to stand by him to depend that he will arrive. He is in support of what the foundation is doing. The purpose of the foundation is to reduce to the barest minimum or even eradicate breast and cervical cancer. And I think that's what one of the things that is big, that NGOs should fight for. So I believe that Chief, this is the kind of cause that Chief supports, and this is the kind of cause that Chief always partner. And I'm going to pass the message of what's here to him so that he can also increase his interest to the organization and also increase the level of support that he intends to do. Thank you very much.
Sorry. Lady.
Before this foundation, I didn't know anything about them. And the level of expertise that when we started from Otocha zone, and now it's going across the state. As you can see how many of them are here today, it tells the story of how much support we've received from this wonderful group. And we're very happy to have them as partners to the ArOY Youth campaign. Thank you very much, Madam, and to the rest of the PPSSC members here present.
Protocols duly observed. May I use this opportunity to thank the president of this foundation. Doctor, thank you very much. And I want to tell you, just as Lady Olasi has said, PPSSC, once you have the teachers and the principals, you don't have any problem. The course you want to achieve in the schools, be rest assured that they are going to make sure that the students are well impacted with the knowledge of this cervical cancer and breast cancer and how it will be prevented. Thank you very much. We appreciate what you are doing, and may God bless you.
Of the Anambra Broadcasting Service, ably represented. That's talking about Chief Nchide Ezonye Chiako, Chief Presenter and Producer, Anambra Broadcasting Service, and a media consultant of the OCI Foundation.
All right, Njide Doubles, I'm glad she's the one to represent the ABS. You know, she's been a wonderful lady. She's our media champion, media consultant to the OCI Foundation. And the Anambra Broadcasting Service has been a very big positive partner to this campaign. Chief Uchenwara, unfortunately, he's not here, but he's one man I'm very, very particularly impressed with. You know, he received our delegation nicely and had us all in all the media outlets of the ABS. Yesterday I met him for the first time, and he was very positive and very passionate. And the OCI Foundation is very glad that we are officially declaring the partnership between us and the ABS. Thank you very much.
All right, thank you. Please,
on behalf of my boss, Chief Uchenwara, our digital MD, the MD, Chief Executive Officer of Anambra Broadcasting Service, OCA, we appreciate the recognition given to us today by the OCI Foundation. ABS is glad to partner with the OCI Foundation. We have already started doing what we can do for them, which is helping them to share the message of Arm Our Youth campaign to Ndi Anambra. We've given them reasonable airtime and we will not relent. We'll continue to help them get to the grassroots, get to every girl in every community in the 179 towns in Anambra State. We are glad to partner with the OCI and we will never relent. Once again, thank you.
It is of great pleasure and immeasurable gratitude that I stand before this magnificent pulpit and before this great and enthusiastic group of people to be a partaker of this honorable event of our time called Arm Our Youth, and to show my sincere appreciation and to show my sincere and personal appreciation this great umbrella of hope. Their immeasurable effort as board of members, whom I must commend and acknowledge that they have proven that success relies on teamwork. They are men and women whom have sacrificed on both times sleep, sometimes joy and ego, for the betterment of humanity. Thank you, one and all. Both in senior secondary and in cycle, which is the university category. I elucidately agree with Albert Schweitzer. At times, our own light goes out and is rekindled by a spark from another person. Each of us has cause to think with deep gratitude of those who have lightened the flame within us. I must tell today that this favor has come in most bewildering moments of my life. When I thought that life is a long, desolate corridor with no exit sign in terms of financial difficulties. I must tell today that not only have this program rekindled the flame within us, but also have given us a new sense of livelihood. They have rekindled in us the sense of giving back to the society. With their beautiful and philosophical way, we rise by lifting others. So let me remind my fellow scholars present and absent here today in those great words of Theodore Roosevelt. Insofar as much has been given us, much also will be expected from us, and that true homage comes from the heart as well as from the lips, and show itself indeed. So we must see this, believe this, and live by it. I want to use this medium also to thank personally Professor Chris Ifediola, whom from the little he has have done more greatly than he could imagine. More greatly than men and women constantly dreaming of the day that they would make a big change in the world, forgetting that it took years to build Rome. So, it will be hypocritical indeed if I allow modesty to forbid my saying that your foundation have in many ways brought monumental changes in the life of many within Anambra and are now spreading their hands. Is the more to reach for the downtrodden is the more. But in spite of this feat, the problem of getting God's children back to school is somehow far from solved. And this is where we need more men and women that are willing to be co-workers with God and to obey the clarion call of humanity and that of Mother Earth. It is about high time we get rid of quantifying our deeds with the phrase too little. For no matter how little we think it may change somebody's life in a big way. And if we go by clinging to this phrase, the change this world so desperately needs will never become a reality, but an elusive dream, the one we can only envision, but will never come to pass. Let us I don't know. Much as I've known, cancer has been a devastating and indeed subject that is life-threatening to the society we live in today.
Thank you so much, Sci-Fed Scholar. Thank you for all the appreciations you've poured onto your sponsor.
maka ife dị ọra na-eme unyere anyị ụmụ ogbenye aka o nwere nsogbu Igbo ebe anọ kwuo about arụ isi ike anọghị a na-ekwu ọ bata n'ụlọ o metụrụ onye ọbụla a na-ekwu maka breast cancer, cervical cancer, asịkwala ụmụ nwoke nwere nkefa eziokwu prostrate. Oh, aging, all those things will come, whether I like it or not. So one weekend, on Australia, not one man and you fed you to. I'm going to look at the kaka, oh dear. I'm going to look at the kaka. So even I was supposed to do the dictionary. I'm looking for a didn't make a then you support. Then you can engage you. If you want to know we made this foundation. We do know now support here. I ain't Chinese nigga. And we'll be on it. They reduce it. Even I be in the mad and so I can have one who comes up 7 in no. All on our where's you? Aka ezigbo oku ka ọ kpọrọ oku ọganiru oku ụlọ ezinụlọ inwe anwụlị maka ezinụlọ ụdị ọhịa abịa akpọlụ ga-abịa oge eji etiriti ya. Onye anwụrụ bifo ọnwụ ya. Si ekene ma unu rinne na-asụkwa Kristi. Ya jisi ike. Ibe ọ na-eme adịrị izu. Ọ dịrị izu. Chukwu ga na-enye ya ọnụ aba ọ ga-alọ nlọ na-alọ nlọ ezigbo ibe. Ibe Anambra ga-ejiga n'iru, ibe Naịjirịa ga-ejiga n'iru. Ekene m unu rinne, biko na-akwado na ya. Ka nwa amụrụ mma ka m na-etu ya. Ka m na-etu ya. So daalụ. Ọkpụ unu ga-eji wee na ga-aka nke unu ji wee bịa mma. Unu ga-ekwudo ozi n'ụlọ n'udo n'ofu n'ofu. Si na Kristi nwe n'anya.
Etu ọgọchala unu in their zones. The books are already packed in bags. So no more controversy. They are already packed in bags. Now, at this juncture, may I...
The demonstration. So the idea behind this app, which is what it's called in short, is to make sure that every single Nigerian has access to the teachings of the ArOY Youth campaign. So the primary focus is on senior secondary school students. But through the app, every one of us here and outside of here will be able to still partake in this particular program. In the past few months, we've done everything humanly possible to make sure that the app was ready before today. And it was indeed ready before today. It went onto the Google App Store just 2-3 days ago. So for those who have Android phones and for those who can download, if you search the OCI cervix breast, so cervix breast is cervix without the X and then breast. So that's how the name came about. If you go onto the Google Play Store and search for that, you will find it and you will download it, and it is free for everybody. Now, this app is very unique. We try to make it to be different from every other app out there. Its major unique feature is that every woman can tailor her own cycle to suit what the app does. So that functionality is unfortunately not ready when it was released, but it should be ready in the next month or so. So when it's ready, what you'll find is when you open the app, it prompts you to, through your cycle, set up your own schedule. Now, for those who whose periods have ceased or who doesn't remember or who are pregnant or something, you can choose your own date. So what it does is every single month, it sends you a reminder. And that reminder is going to happen the same time of the day for over 4 days. Now, if you do the breast self-examination, then you can stop it. But if you don't, it keeps going. After 4 days, it stops. Now, that timing is designed to be the time when you need to do it most, when it best suits your cycle to do it, because you cannot just do it every single time of the month. So that's one big feature of the app. Then beyond that, we also have information on breast and cervical cancers. So basically, everything that is in the textbook that we are giving to the senior secondary school students is also contained in that app. The other thing there is the video of the breast self-examination. So in that video, we have a Belokara featuring in it. So if you download it and you search around, you'll see what I mean. So she tells us a bit about it. She gave us the statistics about it. And then most importantly, there was about an 18-minute demonstration of a step-by-step way of how to do breast self-examination in the correct way. Now in the past, when we were teaching the students in secondary schools, we used images from an organization overseas in Ireland. But we wanted to make this a Nigerian project. We wanted to make it an African project. So we invested in having to shoot the movie ourselves, and it came out even better than what we got from Ireland. So please, let us all be champions of this project. Let us all be mini ambassadors of this project. Download it in your phone, then share it within your networks. Invite your friends on your social media handles, because the message is not for us alone. The cancer may not find us, but it could find someone we know or someone who knows someone we know. So the more we pass on the message of this app, the more we get our friends to download it, the more we are being partners to this particular foundation and partners to the ArOY Youth campaign. So please don't let this message stop with us as individuals. Let the message be passed on. Let people know about the app and let them question to ask. There's a provision for that. It's going to also be on the iPhone. For those who use iPhone, the iOS it's going to be there. It's not there yet. And then, that's about the app. If there's any question, ask on the app. The final thing that will be there is the list of doctors who's going to give support when it's needed. It's not there yet. We're going to invite doctors, gynecologists among us, those who can offer the treatments that are available, so that any lady who wants more information, who wants to see a doctor, can easily tap on it, and it gives you, within your geographical location, the doctors that are close to you. So this is all in the pipeline. This will all be in the app. Thank you very much, and God bless you all for attending this event.
Job today. I don't know where to start and where to end, but my job is very simple. May I thank all of you for being here today. May I, in a special way, thank the founder, OCI Foundation, Dr. Chris Ifediala, Associate Professor. Thank you so very much. And all other members of the OCI Foundation, and you that are here today to listen. May not mention names one after the other, but all of you, we appreciate you. Thank you for coming. And may I also, the Nollywood people that are here today, Ebero Okaro, who have really done great. We thank you. We thank the Igwe that is here, Dr. Ezenye Molo, Lady Olase, the Commissioner for Basic Education. We thank all of you. Please permit me if I sincerely apologize if I do not mention the names of all of us here today. The ABS, who has been so wonderful to us, we thank all of you. Thank you so very much to be here. And in a note, may I also tell you that you must have to key in what the OCI Foundation is doing. Last time we were at the ABS for a program, someone called a man and saying, how do these affect us? We do not have cervical or breast cancers. So I want to sound a warning to all of us men here. We are also involved in this because we have our daughters, our wives. We have to get interested in all we are saying and in all we are doing. I thank you all for being here. May God bless you all. Thank you so very much.
Ekene, nsọpụrụ, isi ala, ugwu niile dịchasịara gị n'aha Jizọs. Papa, anyị na-emechi, ọbụkwa na anyị na-apụ n'ụwa. Otu anyị si duo anyị, wee dute anyị ebe a. Papa, biko, dunakwa anyị n'udo n'aha Jizọs. Ụlọ anyị ga-esila, anyị na-ayọ gị ikpe kpuchie anyị n'ọbara Jizọs. Kpuchie okporo ụzọ ọbụla n'ọbara Jizọs. Ka idubaruo anyị n'udo n'aha nke Nna na nke Ọkpara na nke Mmụọ Nsọ n'aha Jizọs. May we share. And the sweet fellowship of the Holy Spirit with us now and forevermore. Amen. Holy Spirit, amen.
Standing the national anthem. Yes, so the implementation committee.
This app to me is one of the biggest most important parts of this campaign. So it's really available. It's called the Service Breast, OCI Service Breast app. You can easily find it on the Google Store right now. In the next month, it's also going to be on the Android store, so on the iPhone store as well. So the app, free for everyone and available to everyone, not just youth, not just those in high school, senior secondary schools rather. So you download it. For women, it sets you a monthly reminder on to your breast examination. And for every other person, it also gives you tips and steps. And there's a video there that teaches you everything, A to Z of how to do breast examination. and also allows you to get in touch with the OCI Foundation. So it's a one-stop place for everyone regarding the ArOY itself campaign. For breast cancer, for cervical cancer.